Thank you, Chairman Sanders. I'm glad we're focusing on quality dental health care. The HELP Committee has examined health workforce shortages, and so hopefully we can come out of this with legislation that can address issues in the dental field. Now, by the way, passing legislation takes bipartisan support. And I would ask just one more time, encourage greater participation between the majority and the minority. If everybody representing all the Americans we represent, both Republicans and Democrats, come together and are heard, we're more likely to get something which can actually be signed into law. That's why I've said repeatedly, asking the majority to engage the minority in preparation and crafting of these hearings. If we want hearings to be a springboard for passing legislation, we must lay that groundwork together. But I also have to note that there are other urgent issues impacting the lives of our constituents. I've requested for months that we hold hearings on the disturbing anti-Semitism spreading on college campuses. Jewish students are being threatened and assaulted. No student should be afraid while attending school or be a victim of bigotry. But there's not been a commitment from the majority that we will exercise oversight over this response, or the lack of a response, from universities and the Department of Education. We could also hold a hearing on the Biden administration's repeated blunders in rolling out the new free application for federal student aid, or FAFSA application. Some students may forego college because without financial aid offers, they don't know if they can afford. But the incompetent Biden administration bureaucrats who bungled the rollout are not facing any consequences, even though students are. These issues should be bipartisan. We should have Secretary Cardona before this committee to examine him and their response. We have the time. For example, last week we didn't even have a hearing. In fact, we are a year and a half into this Congress and we've not had a single hearing on the state of primary or secondary education, which is, we are the Health, Education, Labor, and Pension Committee. I'll stop there because I don't want to take away from discussing dental care. You know, I helped found a public-private partnership providing free dental and health care to the working uninsured in my area in kind of the capital region of Louisiana. I found out that the pent-up demand for dental care is greater than the pent-up demand for medical care. The uninsured can go to the emergency room, but they can get a tooth pulled there, but they can't get anything else there. Dr. Isbell's kind of shaking his head like he doesn't want that pulled in the emergency room. I get that. But as a rule, the pent-up demand is greater for dental. That said, recent data shows that 88% of Americans have dental coverage. Now, despite this, some call for mandating dental coverage under Medicare and Medicaid. Right now, under Medicare, approximately 98% of Medicare Advantage plans offer dental benefits, and more than half of Medicare beneficiaries are enrolled in an MA plan. That's pretty significant. And in addition, states have the option to provide dental coverage to adult Medicaid enrollees. As Senator Sanders notes, or at least implies, reimbursement rate under Medicaid is so lousy that, frankly, it's the illusion of coverage without the power of access. If you're losing money on every patient you see who's covered by Medicaid, you can't make it up with volume. And that is, and now I see Dr. Swan agreeing with that. That is just a reality. I'll note that a lot of independent medical practices are struggling to provide quality care with low reimbursement rates and the administrative burden that comes with a federal mandate. And some are selling their practice or the doc is retiring. I'm afraid that mandating dental coverage might be similarly harmful. And with Medicare on track for insolvency in a little over a decade, we should also think about making that sustainable before adding programs to it. Now, looking at the commercial market, the vast majority of patients in employer-sponsored plans have the option of dental coverage, and among employers offering health benefits in 2023, about 90 to 94% of them offer dental insurance. And of course, that allows the patient to get the option that serves their need best. So many of these individuals currently get dental coverage through a standalone dental plan, and while major medical plans can offer dental benefits, standalone benefits often also have lower deductibles along with the lower overall medical deductible. However, this year the Biden administration issued regulations allowing states to require ACA plans to provide dental coverage. Doesn't kick in until 2027, but it will raise premiums in these already expensive and often unaffordable plans, or it will increase the subsidy that taxpayers are paying, which means the cost of the bill is stuck on all of us. Now, it's important to note that dental care workforce is also an issue, and that's particularly true in rural and underserved areas and also urban areas. Senator Budd is the lead sponsor of the Action for Dental Health Act, which reauthorizes a grant program through the Health Resources and Services Administration, or HRSA, helping states increase their oral health workforce and provide dental care, particularly in those underserved communities. I worked on this before being ranking member and just understand the importance. The HELP Committee has dedicated 4 hearings to examine health workforce shortages and 2 markups this Congress. We've examined critical programs supporting dental workforce, including the National Health Services Corps. It's important that we get a long-term reauthorization signed into law. We also need to understand that with dentists, we often don't have a supply problem, but a distribution problem. My dentists tell me that there's certain cities we'll work in, but the rural areas it's more difficult to support. This year, it shows that we have 98 to 99% of the dentists and oral surgeons we need, but again, the rural areas, it's only 63% of the general dentists and 44% of the oral surgeons. So impacting the supply and distribution of dental providers is crucial before directing a solution. One way to address workforce shortages, our work to address workforce shortages, should continue to be at top of the mind for the committee, as there will be additional reauthorizations. This includes the Title VII programs of the Public Health Services Act, which contains a number of important programs bolstering dental workforce and access to care. I look forward to the testimony and learning more how we can responsibly improve dental care for all Americans. Thank you for being here.